there are obviously a lot of political issues surrounding the ACA. One of them is the eligibility question. That is, when people either come into the system, that is, they may have a job, and this is what happens to cancer patients. They have a job. They try to keep their job. Their insurance comes to their job, and they lose their job. And somebody says, you can go on COBRA. I don't know if you've ever priced out COBRA. COBRA is not exactly an inexpensive policy for many people who have employer-based insurance. So they fall off the insurance rolls. We would like to see, and I would like to see, better ability for people to transition into coverage. One of the problems is it takes whoever certifies, that people are eligible to go into the ACA because of a life event like cancer, that they can get it quickly without a lot of hassle. A number of years ago, we did something with Social Security, where Social Security has or disability had a long waiting time for everybody who applied for Social Security disability. And the commissioner took it upon himself to say, well, not by himself, it's obviously with a lot of consultation, but he took it upon himself to move forward with a diagnosis-based a priori, a decision that was on its face was appropriate. So if somebody had pancreatic cancer, they could get Social Security into the disability system quickly, as opposed to having to wait an interminable period of time. Those are so that system of getting people on board is important. The question, from a personal point of view, at which the deductible issue could be faced, people in poor communities, and a lot of them don't have the money. In fact, in the entire country, a lot of people don't have the savings to pay for those deductibles. I'm not sure there's an easy answer to that one, but it's something that we need to recognize. There are a lot of care situations where people need the care and they can't pay for the care. And with medicine being the way it is today, one of the things we see happening, developing, evolving, is that more health professionals, more hospitals, everyone wants their money up front. No easy answer to that one. But the access to care is the other piece. And this is not necessarily a legislative issue, but a lot of people have insurance for the first time in their lives. To help people understand. We were talking in a previous discussion about genomics and education for genomics of the population. What about people who don't even know about how to take care of themselves? I mean, and that's not a negative, it's just a reality. What about various communities that may have English as a second language, that don't know what's available? How are we going to address that issue? How are we going to take people who, folks who live in communities where, there may be other, side issues. There may be drugs, there may be violence, there may be questions. How do we get them from their communities, how to get the care into their communities? Those are all issues we have to address. Now, that's not necessarily an ACA issue, but it's the kind of issues we need to be talking about as a country. We need to start talking about the people. And we need to talk about systems of care. And then we got to figure out how we're going to pay for that, because it's not going to come from charging for an office visit. There's a coming expectation that the medical, particularly the primary care system, is going to have to expand beyond taking care of your blood pressure, your diabetes. It's going to have to move much more into the social arena as well. You can't layer that on top without having a system of care that's flexible, adaptable, and responsive.